So like I said, today is mostly going to be a general overview of motivational interviewing. I'm guessing that a lot of you use these techniques every day in the work that you're doing with people, but it fits very nicely into the trauma-informed care concepts that we've been talking about. And also, it's a technique that really anyone can use, whether you're a clinical mental health worker, or social worker, or not. So we will dive into what this can look like. So first off, what is motivational interviewing? I really like to think of it as a guiding style of communication. So it really requires the clinician or the caseworker, whoever's working with the clients, to engage as an equal partner. So we refrain from unsolicited advice, confronting, instructing, directing, or warning. That's not really the role here. We're not trying to set ourselves above or apart. And it's not a way to get people to change. Like motivational is interviewing isn't my way of saying, now if I use this, you're going to change. I think you guys know that, but it's more of a technique or a set of skills that we're using to start the conversation about change. Motivational interviewing takes time, it takes practice, it requires a lot of self-awareness from the clinician. So it's really a way that we're stepping back and seeing ourselves as a partner in this work that our clients are doing. So it means that we're guiding as a style of communication that means that we're walking with our clients, not in front and not behind. So it's a balance between following or allowing for self-determination and directing, which is more of the giving information or education, because that's important. Um, we're trying to this method kind of tries to address the natural power dynamics that exist in all helping relationships. We inherently have the power in these types of relationships, even if we're trying our best to be trauma informed and meeting people where they are. Inherently, if I come into someone's room or if someone comes into my office, I am not the vulnerable one in that session, in that. Um, so let's lean into the power that we inherently have. We can't change it, no matter how much we may want to. So that means that guiding and meeting people on their journey and walking with them instead of trying to impose our power or pretend like we don't have it. Um, it's really vulnerable and at times shameful for people to ask for help or to admit that something they're doing isn't working. So when we come to the table with that knowledge, it means that as helpers, we aren't trying to stifle our power. We're trying to use it wisely and mindfully. Um, so I need to realize that I do have information, experiences, and expertise that the person I'm working with maybe doesn't have right now. Um, so throughout this presentation, I'm going to just give the basics of what this can look like, ways we can talk and ask questions to allow for that process. Um, so next is empowerment. So helping people feel empowered to change is really what it's all about. My role is to help give tools and education, and I can ask some pointed questions to find out and understand what change could mean for that person I'm working with. Um, that my goal is really to support them in a way that change feels possible and meaningful. So identifying the meaning for the change. We don't usually do new things if there isn't something in it for us or it doesn't meet a value. So that's kind of that's the goal of motivational interviewing, is trying to find what that is for the people we're working with. And finally, being respectful and curious. We have really talked about this the last 2 weeks um, with Ashley and Melissa. We've really talked about being respectful and curious and genuine. We've really talked about that quite a bit in trauma informed. So not everyone is ready to change all at once. I'd probably venture to say that none of us are ever ready to make big changes all at once in our lives. most of us need time to think and ponder and work it out in our heads what change is actually going to look like. Um, and sure, we might reach a breaking point where we don't have a lot of choice in the matter, where we have to change, and that feels bad. But also being told what to do and how to do it doesn't usually work for people either. So our job is to ask a lot of questions, to be curious about their experience, gain a deeper understanding of what life is really like for those that we're working with, and how we can work with them and how change might fit into their life right now. Okay, so when we think about trauma informed care, motivational interviewing really aligns with these principles. Um, so the purpose is to obviously meet people where they are and allow for self-determination and to be empowering and curious. So listening and offering appropriate insight. So this is really when we think about in trauma informed care, we talk about everyone is kind of doing the best that they can do in the moment, and that's so pinnacle. Like we always do that in motivational interviewing. We need to be listening and trusting our clients that they are the experts of their own lives. So psychoeducation is appropriate, right? Because I have that expertise and that knowledge that sometimes I can impart, but I can't really impart that until I really have a better understanding of where they're coming from, what their life is like, and not making a lot of assumptions that I know what's best for them when I don't really know them. So, MI motivational interviewing is also super strengths based, but also flexible. So that means, right? You're the expert of you. Tell me more about what that is, and building off of those strengths. So, the fact that people are actually showing up and working with you is a strength, right? And highlighting that, or that they've been sober for 5 days, super big strength. Let's highlight that. Um, but also creative solutions. So what works for this person isn't going to work for this person. Sometimes it will, but not in this exact same way. So we need to be flexible in what we're thinking about too. And I like this picture of kind of the brains where I see a lot of people are coming to us because they're in crisis in some way. We don't usually seek out help unless we're in some sort of crisis, and our job is to be the empathetic and impartial bystander to help make sense of some of the crisis and make it more manageable. Um, and so that means we need to be creative in how we're approaching and thinking about problems, but also recognizing that our clients might know the solutions, they're just not sure how to get there. So we can join them with that as well. Oh, and thank you, Michelle. I forgot to say that at the beginning. Please use the Q&A box if you have any questions. I'm keeping an eye on it, so I will be more than happy to stop and address anything as it comes up. Okay. And then also I think about trauma-informed care as and motivational interviewing as really self-paced and curious. Again, my just because I want to elicit change quickly and could see how change could benefit in their life doesn't mean that that's the pace that the person I'm working with. That's not the pace that they're going. So I I want that to be forefront of your mind. We're going to talk a little bit about what that could look like in practice when someone isn't quite at the table and is maybe ready for some conversation but isn't ready to take any steps. Um, Change always takes time. And it doesn't matter if you're a mental health provider and you know inherently you're educated and you get a lot of this stuff, I still might not make changes that I could see beneficial in my life because it's hard. So I can't sit here and expect someone else to do it super quick either. And then again, building that trust, remaining empathetic, and setting boundaries are a huge part of any work that we do with anyone. But it also means that we're setting boundaries with our relationship. We're helping to guide those that we're working with and setting boundaries with other relationships in their life and for them to set boundaries with us. Um, all in with the understanding and the idea that this is part of building the relationship. And I tell all of my students, you can't do anything until you have rapport. Like, it's really hard to have anyone work with you unless you have genuinely come to the table and worked at creating a little bit of trust. Again, important in motivational interviewing and trauma-informed care. Okay, so I want to ponder this question. What are the indicators of resistance in a client? We talk about resistance a lot. That's a resistant client. And I want to know, without giving you any words ahead of time, what popped into your mind when you heard resistant client? I am going to pull up a word cloud so that we can see this, but I'm going to, let me see here. Actually, I'm going to stop my sharing for just a second so that I can get the link for it and share it in the chat. So be thinking, what is, when you think of resistance in clients, what does that mean? Here we go. And I'm going to drop it in the chat right now. If you were with us last week, you'll know how this works. Click on the link. You can put in a couple of options, just type right in there. And then I will present this and share my screen so we can see when they start rolling in. Oops, I shared it just with Michelle. Let me share it with everyone. Can I share with everyone? Michelle, I see that I can only, why is this not working? Let's see. Michelle, are you able to copy and paste that link and send it to everyone? It's only letting me share it with the hosts and panelists.
I thought I was copying and sharing it, but it pasted something that I already had on my clipboard, which is about my skills in a program that we use here on campus. So let me try this again. I'm going to copy it. Dang it.
Is it not working?
It's not letting me. Here, actually, I clicked on the link. We got this.
Okay, we'll do it.
I'm going to copy and paste it from my browser because I clicked on the link.
Thank you. It'll work.
There. Does everybody see it?
Okay, perfect. Thank you. Easy peasy. Okay, so go ahead and click on that link and you can do a word cloud, and I will present my screen so that you guys can see what everybody is thinking. So again, what are the indicators of resistance in a client? So hopefully everybody was able to get that link and can click on it. Is it working? There they come. Lack of participation. Absolutely. Okay, yeah, someone put in the Q&A, shutting down, isolation. Yeah, I'm going to give you guys a little bit. Late for appointments, not sharing, not showing up, right? Resistance, avoiding, no show, defensive. Yes, absolutely. Not sharing. Closed off. Excuse me, closed off. Yeah. Oh, I like that. Yeah, somebody put in here, very agreeable. Yeah, absolutely. So it feels kind of fake, not open-minded. Yeah. Guarded, stubborn. Absolutely. So really hearing this idea that people are not participating, not showing up, not doing the work, right? Absolutely. That's hard to work with. And I think we talk about resistance a lot. We talk about viewing people as being resistant. So I'm going to go back to my PowerPoint and Get that pulled up here. So then let's think about, what does that mean about us? If I have a client who's not showing up, who's not participating, one word answer, arms crossed, sitting, looking at the wall, all these things that you guys talked about as being resistant, what does that say about us? What emotions does it bring about us and our ability to help? So we're going to do that word cloud again. You should be able to click on the exact same link, and we'll do the second one. So, yeah, what does the client's resistance say about us? Let me clear out the results, and I'm going to share it again. Okay, so there, you should be able to use the exact same link in the chat. Yep, here we go. No trust. Yeah, so what are the feelings? What are the feelings that are coming up as far as when I have someone who's not showing up, not doing the work? What are the feelings that are coming up for me? Yeah. So maybe I don't seem welcoming. I'm not getting through. I need to work on rapport. Maybe I'm guarded, right? So failure, absolutely, right? It's bringing up all these feelings of helplessness, failure, I'm not doing it right, right? Frustration, bias, I'm incapable. Yes, right? This is when that imposter syndrome is just talking to us like, you are not good at this. You shouldn't be doing this. You can't even help this person, right? All that chatter in the back of our head. Mm-hmm. Yeah. Questioning our own skills. Somebody put in the chat that it's normal. It is normal. Yeah. And sometimes it's hard to believe that. I rationally believe it's normal to not be able to build rapport like that and to do good work like that with people. And it still sucks. It's still hard. So yeah, lack of engagement, all of these are wonderful, right? It brings up these things in us that don't feel great. Sorry, I'm switching back and forth a lot, and mostly because um, it's weird to do it all while you're sharing a screen. So there. Okay. So we're going to get back to the PowerPoint. So absolutely, right? And trauma-informed care really tells us, and so does motivational interviewing, that we can flip the script and maybe not talk about resistance and talk more about what's this partnership look like. So I heard this in a different training. I've totally adopted it. I love it. Using the word discord instead of resistance, because then it gives us um, permission to feel what we're feeling too, and validate it and recognize what does discord in this relationship look like. To me, it means I have to get a little bit uncomfortable. I have to own up to my part of the story, and I have to try something different. And sometimes that doesn't feel great. But if I do identify what I'm feeling and identify with it and figure out if it's getting in the way of working with an individual, that's that's what we're doing, right? So if I'm sitting here thinking I'm working harder than they are, I'm tired, I'm busy, I'm worn out, I don't have time for this, they keep making bad choices, that keeps them over here and me over here, and I can say they're resistant, they don't want to change, right? If I start to think, oh gosh, there's something happening here and I have to really like meet them where they are and this is hard and I don't like how it feels, but my empathy to build connection then is I want to understand, maybe there's more to the story, or there's benefit in staying stuck. There is benefit for doing things that don't work. And sometimes that's part of the story, right? Sometimes that's part of what's happening, and that's okay, and that is fine. And me thinking, I'm bad at this and I don't know why I'm not getting through to them. Maybe I just need to pass them off to somebody else. That's okay too. But sometimes it works better if I say, I own part of why this isn't working, and so does my client. Let's see if we can try something new. It's vulnerable to try something new, right? And if we do that with people, it's also setting the stage of maybe they're willing to talk about their vulnerability and trying something new as well. I wanted to, you've maybe have all seen this video from Brene Brown, but I love it, and I show it in a couple of different um, trainings, but it's really her take on empathy versus sympathy. So I'm going to share that and we're going to watch that really quick. Let me know if you can't hear it for some reason.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Okay. I just think that that is lovely. Let me get back to my PowerPoint. I just really like how she gets right to the point of what we're talking about here, as far as I need to recognize what it's like to have something not go well in my life, to recognize my own feelings in resistance or discord of feeling not good enough, so that I can truly empathize with where someone's coming from. In trauma-informed care, we're doing that all the time, where we have to grapple with our own stuff. And obviously doing it in a way that we're not getting burnt out or overwhelmed. Empathy is work. Empathy is feeling something. We connect with people because we can connect with the feeling that they're feeling. It doesn't have anything to do with the content of their story. Typically, it has everything to do with um, knowing what it feels like to feel rejected, knowing what it feels like to be not good enough, knowing what it feels like to be abandoned, right? We are identifying with that feeling, grief, loss, all of those things. And it makes us have to be vulnerable in the moment. And sometimes we're not ready to be vulnerable in the moment. And that's discord, right? I'm coming to the table, but I'm not ready to grapple with my own grief. And we're talking about grief with you. This is hard. This is really hard. And that's normal and that's okay. And that should be thought about and not avoided. That's part of the power that we come to with the table too. I could be really struggling with the grief of losing someone important to me, and the person sitting across the table is as well. And I'm not as open and vulnerable and empathetic as I need to be, because realistically, I need to, if I'm going to kind of hold it together, I need to be a little closed off. And that's fair, but we have to figure that out for ourselves when we're working with people too. Okay, so let's get into some of the core skills of motivational interviewing. Perfect, we're like halfway through. So OARS is something, if you know anything about motivational interviewing, this comes up over and over again. And if you don't, we're going to talk about this acronym. So the first one is open questions. This is really seeking to understand what the person already knows. We talk about using open-ended questions all the time. I like to, for myself, and when I'm doing supervision or working with students, talking about having your tool belt full with phrases that you use over and over again, because sometimes when you're in the middle of a conversation with somebody, it's hard to remember, like, wait, how do I ask this question? What's an open-ended question? What does this look like for whatever reason? Sometimes people just throw us off a little bit. So using the same types of questioning over and over again really makes it feel like a little more in control of the conversation too. But we want to know, what does this person know? We don't want to make assumptions, and we don't want to impose our knowledge on them if they already know it. It's a waste of everyone's time. The next part is the affirmation. This is that real strengths perspective, social work perspective of recognizing the strengths, efforts, and successes, even if it doesn't feel like that when the person's talking about so many things that are hard, and we come in and say, you are dealing with a lot of hard things. I'm so glad that you've come and asked for some help. I think that it's hard to do it on your own, right? So we're validating and we're affirming what they're doing, and picking out those little things can make all the difference in building rapport and building trust as well. The R is reflections. This is that active listening. Active listening is a skill. It's not something we're born with. We have to practice it. And we have to practice listening without thinking of what we're going to say next. And that's the other reason why I say have your tool belt of phrases that you commonly feel comfortable with and fit your style. Because sometimes it takes a lot of work to really listen to what they're saying and not get stuck 5 topics before when they're still talking and circling and thinking about what you wanted to ask with that while they're on to something else. So really practicing your active listening, and then doing that rephrasing, repeating. So if someone talks your ear off for 10 minutes and you're able to rephrase it and say, it sounds like you really feel alone in the struggles that you're dealing with, and don't feel like you can ask anyone for help. That's got to be really hard, right? Even though they were talking about their mom cut them off and their dad quit paying for their car and they lost their job and their boyfriend broke up with them, right? But really, what it's like feeling alone and isolated. And so we're really hearing that they're saying that, and we're naming what what's the overall of what they're talking about. That shows empathy, and that shows that we care. Like I said, active listening is a skill. So not getting stuck in our own head takes practice. And then summarizing, again, sharing the highlighted points, sharing if there was some goals that were set in there. I'd really like to do this, but it feels really hard. Naming that, I heard what you said is you'd really like to change this pattern, and it feels really hard because of X, Y, and Z. So that's ORS. So open questions, affirmation, reflections, and summarizing. Pretty straightforward, pretty much things that you probably do a lot, but really recognizing the goal behind them is to make this person sitting in front of you the expert of their own life, not impose your own stuff onto them. And then also getting enough information so that you can figure out, what does my experience and expertise lend to this situation, without putting that on them right away. If you guys were with us last week, Melissa did a really nice job of outlining, sometimes when we walk into a room with a little bit of information, we make a lot of assumptions about what someone needs without actually hearing that from them. But that's not always the case. So we need to start from scratch and do our own assessments as well, because it it can change based off of who you're talking to, what you're comfortable sharing as well. Okay, so we're going to really just get a little bit into what this language looks like and how we can engage with people, because the goal is to get from pre-contemplation. So if you've heard motivational interviewing, you've heard this term like pre-contemplation and contemplation. And basically we want to get somebody from this pre-contemplation stage where they say, I don't have a problem, this isn't a problem, I don't want help, to we're engaged, we're having a conversation, and we're goal planning. That is the whole point of motivational interviewing. So it's identifying the willingness or readiness to change. That's a lot of the hard part, right, is working with someone who's not ready to change yet. If somebody comes into the office and say, this isn't working, I need help, perfect, great, I have all the skills to do that. But when someone say, my mom made me be here, I don't want to be here, I don't have a problem, this isn't helpful, what do we do with that? So this is kind of a nice little visual of what this could look like. So no change talk. Someone's coming in, right, and saying, this isn't anything I want. This isn't a problem. I don't know why people think this is a problem. This is working for me. Okay, so no change talk. Our first place to go here is that empathy, curiosity, and acceptance, right? I need to know a little bit more about why this person is here and what does it mean that they don't want to change. That also means that we are in rapport building, trust building phase, hardcore. That's our purpose right now, right? So we need to be predictable. If we set up an appointment for Thursday at 3, we are there at Thursday at 3 and they can count on us. Or if we need to reschedule or cancel, we're trying to give plenty of notice so it doesn't feel like we are not on their side or don't care. Sometimes that no change talk is also a testing, right? I don't feel supported by anyone in my life. How are you any different? Let's see what you'll do with this, right? Sometimes that's the benefit behind it. Then that makes sense, right? If you've been hurt by a lot of people or people have let you down a lot over your life, how is this person sitting in front of me going to be any different? I get it. I'd be closed off too. So the goal might just be to schedule more meetings. The goal is maybe not to have any goals. The goal might just be, I really appreciated talking with you today. What would it be like if we set up another time to chat next week? So this is what it would look like. So if somebody's coming, why would I go to therapy? There's nothing wrong with me. It's all their fault, right? Who's talked with somebody like that before? I have, and maybe you're right? I don't know yet. But also I am under the mindset that therapy helps everyone. So I'm going to be a champion for it, right? So something that I can say to someone to express the empathy, curiosity, and acceptance is totally understandable. We all have different ways of dealing with hard things, right? So it's accepting and it's validating. I would follow that up with a question like, tell me what you do to deal with hard things. What does that look like in your life? I'm not making assumptions. I'm not saying that therapy is the only way. I'm starting to be curious and flexible to see if we can work within what they're already doing. And then also that building trust and asking permission. So that could look like, is there anything that you think would help? I'm happy to explore options if you'd like. So again, I'm not imposing a lot of information. I'm not doing a lot of that quite yet. I might say a little something if they're saying, oh, I deal with it by drinking all the time, right? I might ask some more questions about how that's impacting them positively or negatively. And we'll talk about that, some different methods of doing that as well. But I want to get as much information as I can about why people are doing what they're doing. There's a purpose and it started for a reason. So just because it might not be working very well for them right now doesn't mean that it didn't start with a purpose. We revert back to what we're good at to our defaults, positive or negative, what we know in interpersonal relationships and coping skills and positive or negative ways of dealing with things when, you know, things get hard and we're in crisis. What's our default, right? Is it isolation? Is it addiction? Is it lashing out? Is it not plain? Is it using your skills to we like to say to be a victim, right? But what people are doing with that behavior is getting their needs met in a really in a way that doesn't always feel good, but they're getting their needs met, right? So that's what we're doing. We're meeting a need. We're meeting a desire. We're doing something that's fulfilling something. My job isn't to judge that or to tell someone they're doing it wrong, but to recognize like you learned that for a good reason. That kept you safe for a long time, emotionally safe. That behavior is isolation has kept you really safe for a long time. And now you're seeing that it's really hard to do these hard things in your life without support. So I'm naming it, understanding it, and not judging it. There's a purpose for behavior, and it might not be working as well as it used to anymore. That could be some motivation for change. But I have that in the back of my head. I might not say all that in the first session with someone or the first meeting with someone when I'm really trying to get to know them and where they're at, but I'm thinking that that's trauma informed and that's patient centered, client centered. Um, but also helps me build empathy for someone and patience for what they're going through. Okay, the other thing I wanted to talk about is when we talk about sustaining or change talk and praise versus affirmation. I, when we're talking about um, being supportive and strength based, I think it's really easy to use praise. I'm going to give some examples, and this takes me some time to really think about what's the affirmation instead of the praise. Um, so if someone's saying to you, I know I need to make it to these appointments, but it's been really hard getting off of work, right? Um, Instantly, what comes to my head is praise. Oh, it's so good that you came to this appointment today. It's praising the behavior. This has a place and it's good, right? We do this all the time. Affirmations would say, you being here today shows commitment to yourself and your own healing. So we're noticing what the change is. We're noticing the feeling behind it, and we're talking about that. This always takes me a little bit of time to think about because praise just comes so much more natural when I'm working with people of just a one-off of what they're doing. But the affirmation really allows you to talk about um, the behavior and the motivation behind the behavior. So I think that it's a really good way to start talking about change with people because I'm saying you did something different today. I recognize that. What's that like? You know, that gets us to that conversation of being more comfortable with doing something different versus just, oh, I'm so glad that you're here today. That's great, and some people just need to hear that, but it doesn't for motivational interviewing when we're trying to encourage and support and empower someone to make some changes in their life. The affirmation gives us more direction for that. So if I gave an affirmation of you being here today shows your commitment to yourself and your own healing, that opens the door for someone to say, yeah, you're right. That is important to me. I haven't been taking care of myself. I'm realizing how stressed out I am and how much I need this. That's the goal, right? Magic wand, best case scenario. That's what somebody's thinking or says out loud. But if not, you get people sometimes who hear that and they're like, oh no, my kids are more important. I'm just doing this because I know I need to. But that gives us a lot of information too about what's their motivation. They just talked about their kids' needs being more important than them. So I can still come back and say, it's really hard to take care of your kids when you feel like you're not being taken care of, or you feel like your mental health or these things in your life aren't going well. Um, I have a lot of respect for people who are trying to put their kids first, and it's so hard when you are dealing with so many things. So we're still able to get back to that praise, get back to concrete examples of what they're doing. And sometimes it's just really asking or showing that you're there and supportive in a different way. Okay, so I would encourage you to start thinking about affirmation. So pulling out the skill or the change that we're hoping to talk about, and rewording how you're praising, and really figuring out what's the behavior or the action that I can talk about here. And I believe I have more examples on we gave you the PowerPoint slide and a handout, and I think that there's a couple more examples on the handout as well with affirmations, so it could give you some more examples. So now, this isn't I don't think this one isn't praise or affirmation. This is a little bit different of how we're going to be talking with people, with another example with engagement, and then evoking change, right? Finding meaning in change. So say I'm working in a hospital and a teenager is coming to me and saying, well, vaping is better than smoking and everyone I know does it, right? There's not a lot of change talk there. So me just saying, well, it's still bad for you. It's still like poisoning your lungs and these chemicals and all this research and da 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 da, right? We maybe need to engage them in the conversation first before we do that education. So I might say something like, it sounds like you might be the odd one out if you don't vape. What would that be like? Right? That could be awkward to ask a teenager, but I bet you they haven't thought about it. I mean, I bet you they have thought about that before, about fitting in and what if I didn't vape and what would that mean for me and my friend group. So I doubt that that's something that has never crossed their mind. It's a different way of engaging, and also saying like, I could totally appreciate not wanting to be the social outcast. Um, that is important for engaging in a conversation that feels not judgmental. And oh, good. I was just checking. So yeah, Michelle's shared the handouts again. So hopefully when I was talking about that additional one, it should be in the chat again. Um, so again, it's really thinking about, what are they telling me? What's the emotion it's pulling out of me, right? I don't like to be social outcast. I don't like for people not to like me. I don't want to be isolated, right? That brings up that feeling of me. I remember what it was like to be a teenager and feel like I had to be cool and impress people. And the only way I had a friend group is if I did what that friend group was doing, right? Those are real things that happen in most teenagers' lives. So if I can tap into that, that can be really helpful in engaging with people. So the other one is this evoking, right? This is finding meaning for change. These terminology is also on that handout. I didn't have time to talk. There's a lot of like terminology and acronyms in motivational interviewing. So they're on that sheet. In the next phase of our trauma-informed care that we're going to do, we'll go a little bit deeper into these, but I really wanted to give you guys just some tangible things that you can use right now with people. So The one that I like is the barriers and benefits for talking about motivation and reasons for changing, right? We have values that keep us doing what we're doing sometimes. So saying things like, what do you like about vaping, right? Or is there anything you don't like about it? And then also switching it, what are the pros and cons of quitting? So what's the pros and cons of doing it? What's the pros and cons of quitting? Those are two different things, right? Maintaining a behavior is one thing, and starting change is another thing. So sometimes it's helpful to do that and really starting with what are the pros? If the pro is I have friends, that is like super important, right? We have this person here that doesn't want to feel isolated, that wants to feel included, that is worried about not being included. Um, so maybe our conversation goes more towards that direction than this behavior of vaping or smoking, because that's the outcome of feeling included. And so if we just stop, say, well, you can't smoke or vape anymore, and we haven't done anything about how they're going to have friends, that there's no motivation for change there, right? Why would I quit doing this if at my core I just want to feel included and belong? So really starting to talk about it as like almost a pro con list of talk to me what it's going to be like if you quit. Talk to me, um, what's the hard part about quitting? What's the easy part about quitting? What do you like about vaping? What do you not like about vaping? Sometimes that can help just make it a really rational conversation. We can take some of the emotional connection out of it, just to have that rationalization. And then we can get back into the emotional piece of it. So I want to understand the purpose of this behavior, and then we can talk more about what that looks like in your environment and if it is a meaningful change. I'm not going to change what I'm doing if it's getting me ultimately to my goal. If ultimately my goal is to have friends, why would I quit, right? So we have to figure out what that change would sustainably look like. Yeah. Okay, so here's another example. My kid won't listen to me. He's completely defiant. It's not my fault. He misses curfew. If he wants to be in trouble, that's his fault. I, s- I, when I, when I see this person saying this, I see defensive, mad. I'm at the end of my rope. This is where we are, right? Okay. So let's engage and accept, right? Because part of me is like, this is a child and you're his parent. So yes, it does fall in your lap. That's like the quickest way to end rapport ever. So it sounds like this has felt like a battle for a long time. That's so exhausting. Let's get down to her level or his level, like the parent's level. That's who I'm seeing we're talking to here as a parent. Let's engage and accept. Let's say that response makes sense based off of this experience. Um, Very important for building trust and rapport. Um, so not allowing our own stuff to get in the way of you're the parent, why aren't you parenting, right? Why are you letting this happen to you, right? I could be judgmental. I could do all those things. And if I put myself in this parent's shoes, that sounds terrible. To be at your wit's end with your kid and be really worried about their safety. That sounds really bad to me. I have to really to really go there emotionally. That's not a great feeling. So that's what I'm connecting with this parent with, right? That sounds really hard. Sounds exhausting. Um, and then that affirmation again and summarizing. So your willingness to participate in this conversation still shows that you truly want what's best for your son and feel stuck in knowing how to get there. So again, we're affirming that this sucks, but we're also saying what's the behavior? What are we seeing right now that's something different? And that is that they're showing up, they're having a conversation about it, and that's me, right? Recognizing that feeling again that it brings up in me when I hear this parent talking. Ooh, I'd also want to distance myself because I'm at the end of my rope. I'm getting defensive. This is, that feeling, I can identify that feeling of feeling stuck and feeling frustrated and feeling like everything I do isn't working. I'm a bad parent. I can go there, right? I can feel that and I can name it, right? And I can summarize what they're saying too. So again, the affirmation is picking up on the behavior that they are doing and making some meaning to it. And then also saying, I hear that you feel really stuck. The goal, again, is that this conversation goes somewhere emotional and meaningful so we can find ways of reconnecting. And that's not easy for people to do, understandably. Um, so, um, yeah, so we've got like 8 minutes left. Throw some Q&A in there. I just wanted to make sure that these concepts, very brief overview of these concepts, but they're starting to make sense. I'm guessing that a lot of you are using them without knowing that you're using them. It gives you some names for it, but that handout that I included with the PowerPoint can be really helpful and really refreshing, or getting comfortable with the terminology and what that looks like. There's so many great examples of motivational interviewing online, and um, things you can download to help hone these skills. But really, when it comes down to it, it fits so nicely within trauma-informed care, because it's really saying, um, we we're coming to the table with some power. We do have knowledge, experience, but it's giving us some tools of how to join with people to make that accessible and not create division or barriers there. So I'll stop sharing I guess, yeah, I'm going to stop sharing my screen. I don't see any questions, which is great. I know that this was an overview for a lot of you. But I would just continue to keep in mind, especially that terminology of the resistant client. If we can start thinking about it more as discord, that brings us to the table as having a hand in why this is hard, or gives us permission to try something new or be vulnerable, or even recognize this person maybe just isn't ready to have these conversations. And maybe that means I just need to take a step back. And that's all we're doing, is planning more conversations, building trust and rapport, and seeing if that will happen eventually. Sometimes that's the best we can do. So yeah. Michelle just dropped the satisfaction survey in the chat box, so make sure that you click on that. If you've done trainings with us before, you know that once you complete that survey, you'll get an email with your CEU certificate. Sometimes that'll go to your junk mail, so be mindful of that too. Again, feel free to check out our website with all of our trainings and upcoming trainings and recorded asynchronous trainings. Like I said earlier, those are free. The asynchronous ones, the recorded ones, are free to watch. If you don't need the CEUs, if you need the CEUs, we have a short quiz, and you could pay for your CEUs that way. And again, next month we've got teen dating violence with Heidi Rueda, and we've got some other really cool trainings coming up later on this spring. So be looking out for those. Okay. Well, I don't see any questions. So is there anything I'm missing, Michelle? Did I kind of cover everything?
No, I think you have everything. I don't have anything else. And so, of course, anybody who has any questions or has trouble with the survey or their CEU certificate, you could always email me. I think you all have gotten at least one or two emails from me before. So mdnelson@unomaha.edu. And thank you so much, everybody. And hopefully we'll see you next week for the final session on this trauma-informed care training series. So I'll go ahead and end the call now. Thank you. Bye-bye.
Thank you.